MRI scans can be hugely anxiety-inducing for patients, waiting for it to be over with just your thoughts for company, hoping the results aren't as bad as you fear.
Are you okay? Yeah.
But sadly, for so many people, the wait begins much sooner and goes on far too long. That's why the government is turning to private facilities similar to this one to tackle the backlog.
When we have the capacity in the independent sector, as the Health Secretary said, we just need to utilise all of this together, then that's the thing that impacts so positively on patient outcomes by getting them in earlier, by getting an earlier diagnosis so that we can manage them much more effectively.
The Prime Minister made cutting waiting lists one of his top priorities. There has been mounting political pressure on this issue, some of it unexpected.
I would like to pay 10 for 10 or 20 scans. I don't know how we're going to work this out, and hopefully some other people will follow, because it seems ridiculous.
Labour have backed the use of centres like this, but say it comes too late, claiming hundreds of thousands of NHS patients could have been treated sooner through private services. Patients like Cassandra Warrington. She's been waiting months for a new hip, and it looks like the operation could still be a year away.
And now I'm at the point where I can't even walk around the house. I've got crutches around the house, into the car. I've got an electric scooter. I'm looking at trying to get some kind of a disabled car with like some kind of ramp. I can't take the kids to and from school. I can't make the toilet because I can't walk up there.
Private companies providing services for NHS patients isn't new. It was a big part of Sir Tony Blair's reform programme when he was Prime Minister. And while some may talk of taxpayer money going to shareholders, the truth is there's a lot of support for collaboration with the private sector. But of course, there needs to be the staffing capacity for that to happen effectively. And this is a workforce in crisis.
Frankly, you can hire hundreds of machines off whoever you like. But if you haven't got any staff to work them, then they're no use. And they're not going to reduce the waiting lists.
Places like this are just one small part of tackling the backlog and preventing deaths by delay. And with the government admitting waiting lists will likely rise even further, many are calling for much more drastic action. Becky Cottrell, Sky News.